right, Dr. Katz, the floor is yours.
Okay, so this patient came in overnight, so I just met her really quickly this morning, but I don't know her very well.
Okay.
So the chief complaint is she's a 67-year-old female with end-stage renal and dialysis Tuesday, Thursday, Saturday. I think, or it's Monday, Wednesday, Friday. I think it's Tuesday, Thursday, Saturday. HIV, she's coming in with back pains and starting dialysis 5 weeks ago. So the patient reports she was in her usual state of health until starting dialysis 5 weeks ago. At that point, she noticed intermittent chills with back pain, worse when arising from her dialysis chair after each session. She describes the pain as throbbing in the lower lumbar region, non-radiating, worse with lying down and sitting up. This has been slowly progressive over the last 5 weeks. She was recently seen in the ER on September 6th for similar complaints, and she had a CAT scan at that point that did not show an RP bleed, and she was given gabapentin and Valium without relief. She doesn't have any fevers, no numbness, no tingling, no chest pain, shortness of breath, nausea, vomiting, or diarrhea. So her vitals on arrival, were normal. She was a little bit tachycardic, and she was then, because of her representation for similar complaints to the ER physicians asked radiology to get the CAT scan and to evaluate for bony pathology, and that showed erosive discitis, osteomyelitis at the level of T9 to T10, and then she was given antibiotics, she was given vanixosin, morphine for pain control, and admitted to us. So her past medical history, she has HIV, she has end-stage renal, she has diabetes, she had 2 C-sections in the past, she's on her medications at home, she's on HIV meds, she's on Norvasc, aspirin, and Lipitor. She doesn't have any allergies, no family history, no toxic habits. So on exam, so I told you, so her vitals were, she was afebrile, a little bit tachycardic, and then the resident overnight said she was a middle-aged woman, appearing comfortably, speaking in full sentences, except when rotating. She had moist mucous membrane, she had regular heart exams, she was regular rate and rhythm, normal S1, S2, no murmurs, no rubs, no gallops. Her lungs were clear, abdomen was soft, non-tender, non-distended. Her back exam was non-tender to palpation. She did have a 1 centimeter subcutaneous smooth soft density, likely consistent with a lipoma. She had no edema in her extremities, and she was ANO times 3. On her lab, so her white count was 7.1, hemoglobin of 8.8, platelets of 271. Her basic was normal. She just has a creatinine of 3. She's end-stage renal. Her hepatic panel, she had an AST of 16, ALT of 9. I forgot to write down the alk phos, but I'm pretty sure it was normal. Her cogs were fine. She had an elevated ESR 85 and an elevated CRP of 92. Her imaging, I didn't look at the chest x-ray, but the read was that she has a dual lumen right-sided hemodialysis catheter, and that's unchanged in position. No evidence of acute cardiopulmonary disease. And then the CAT scan, I mentioned, so no RP bleed, no aggressive osseous lesions or fractures, atrophic kidneys with bilateral non-obstructing renal calculi, and no hydro. So assessment and plan for her, so she's a 67-year-old female with HIV, end-stage renal, on dialysis, who has 5 weeks, on dialysis for the last 5 weeks, and she's coming in with progressive back pain without any fevers or leukocytosis or any localizing infectious symptom, but she does have an elevated ESR CRP. So then the plan for her, we're going to continue her on the antibiotics. She's on vanixosin. We're going to get an MRI of her spine, trend her ESR CRP. She's probably going to need a PIC for long-term antibiotics, so we should talk to IR about getting that set up and figure out with our social worker like where she's going to go from here. We'll continue her HIV meds. We'll put her on sub-Q heparin, give her a diet, and then according to the resident last night, she's DNR DNI, and they said they confirmed that with the patient on admission.
Okay.